Then there's California, a podcast featuring members of the California State Senate Democratic Caucus in conversation about their legislative priorities, policies, and other related issues that help make California exceptional. From the state capitol in Sacramento, I'm Brian Green. It has been said that when a doctor runs for elected office and becomes a politician, he or she is simultaneously duty-bound to honor both the oath taken as a physician on behalf of his or her patients and the oath as a lawmaker on behalf of his or her constituents. Then, for that doctor, what follows is the often delicate dance of balancing healthcare priorities and patient advocacy with the sometimes tense political atmosphere and debate that most certainly impacts and influences those priorities and advocacy. And I would venture to say that no medical practitioner turned lawmaker understands that existential and literal tension between the medical and the political, more so than the doctor who has represented California's state capital city in the legislature for the past 12 years. Dr. Richard Pan is the state senator from California's 6th District, covering parts of both Sacramento County and Yolo County here in Northern California, the first Asian American to ever hold that Senate seat. And as I've said many times before, if you live in California or really somewhere, anywhere across planet Earth, and you have followed health-related or vaccine-focused news for most of the past decade, especially during the COVID pandemic, how could you not recognize the name of Dr. Richard Pan? Dr. Pan and his wife are medical practitioners here in Sacramento. Dr. Pan has his own pediatric practice, and he has made preventative child health care and treatment both a medical and legislative priority. Senator Pan is the longtime chair of the Senate Health Committee and the former chair of the Senate Budget Subcommittee on Health and Human Services. He's also the chair of the Asian Pacific Islander Legislative Caucus. Prior to his time in the Senate, Dr. Pan was Assemblymember Pan, representing Sacramento in the lower house for 4 years and chairing the Assembly Health Committee. Regrettably, this fall, Senator Pan will be one of 8 state senators who will be leaving the legislature, either choosing not to run for re-election or, in Senator Pan's case, being termed out after those 12 years in office. Senator Pan has joined us several times on this podcast in the past, and on this edition of Then There's California, we'll talk to the good doctor, described as both brainy and studious and good-humored and good-natured and unassuming, about his personal background and his passion for medicine, the milestones of his legislative career, and his reflections on the high-octane environment and world in which he has legislated. What California and the rest of the country and the world should be paying attention to as we recover from COVID. And, of course, vaccines. Dr. Pan, good to have you back with us again, at least one more time. Welcome.
Thank you so much for having me.
Good to see you, sir. How you been? Everything going well as you wrap up the legislative session here?
Well, I think we've concluded a very successful session. There's a lot of healthcare accomplishments this past year, and certainly been very proud to represent my constituents here in the Sacramento region, but I'm also looking forward to perhaps returning to do a little more pediatrics.
So as you ended this last session, what were some of your reflections or your perspectives with your colleagues on the Senate floor at 1 a.m. on August 31st? Oh my God, this is the end of it? Or was it a more nuanced kind of feeling?
Well, I mean, I think I ended the session with bittersweet reflections, because I think that we've been doing so much good work for the people of California and for my district. And I'm very proud of what I've been able to do. While certainly the opportunity to continue that work would have been very appealing, I think it was also a good time to say, you know what, it's time for me to go back and do a little more pediatrics, get more engaged in more direct patient care and other types of activities like that, and be an ordinary citizen who may sit back and critique what's going on in the legislature a little more than being in the middle of the debate. So kind of looking forward to that, but also appreciating all my colleagues who've worked so hard to get so many good things done for the people of California. And certainly there's a lot more work to do, and saying, well, I won't be a part of that in that way as a legislator, but I'm still going to be around.
You'll still make house calls.
Yes,
so
I'll still, yes, exactly. I'll still make house calls, and I still live here in Sacramento, so I can come by the Capitol and bug you guys about things I think you need to do.
Right. Well, did my illustration there at the front about the medical oath as a doctor and the constitutional oath as a lawmaker and the sometimes admittedly toxic mix of medical advocacy and political dynamics, did that make sense to you? And is that a hard oath mix to balance and follow sometimes?
No, both oaths ask us to serve the people, right? As a physician, I swore to put my patients first. As a legislator, I need to put my constituents and the state of California first. So I don't see an incompatibility between those two oaths. I think that perhaps where some of the tension comes is about being pragmatic enough to be sure we come to solutions, right? It's important that we continue to move our state forward. I've devoted my career to helping kids stay healthy and be healthier. And I think my work in the legislature has been about not only the kids, but keeping Californians healthier. We have a lot of things going on in this country, around the world, and California is taking a leadership role. I'm proud to have led some of those efforts. I'm proud to have supported my colleagues who have led in other areas. And yes, we have many problems we're facing in California. And have we solved all of them? Of course not. But I think that we're working hard to try to do what we can as government leaders. And then, of course, we need to partner with other leaders in business, in labor, in community organizations, in advocacy groups, to solve the problems that are facing both our state, but also our country and the world.
This end of legislative session was one of many that you have gone through in your legislative career, not only during pandemic times, of course, in the last couple of years, but during fiscally grim times, and even also during times of fragile democracy and civil unrest, to fast forward to the present. Reflect back on the 12 years and the milestones that you and your colleagues have dealt with in the last decade plus.
Well, when I first came into the legislature, we had a $28 billion deficit in the state budget that was under $100 billion. And I remember walking into Memorial Hall as Governor Jerry Brown talked about what we need to do to try to stabilize the state's budget. In my last year, it looked like we had a multi-billion dollar, I think they were talking about $90 billion quote-unquote surplus. It's not really a surplus, at least beyond the initial projection of the governor's January budget. So I can't take credit for it, but I'd like to say that the state's fiscal situation has, on average, consistently improved while I've been in the legislature. And that's actually thanks to leadership from the people who voted for initiatives that help us raise more revenue, from governors like Governor Brown and Governor Newsom, who've in their budgets have made wise decisions to put funds into reserves. But also, of course, the legislature and I and my colleagues have also crafted budgets to ensure that we created reserves to help protect our state during a downturn. And in fact, when COVID first hit and we were anticipating a potential downturn, we did not have to make the kind of cuts that I had to make when I first started in the legislature and my predecessors. The other actually big landmark for me during the legislature is I happened to come in at the time in which the Affordable Care Act had passed and the state was in the process of implementing it. In fact, I had the privilege of being able to author legislation to put into state law the insurance protections that Californians enjoy and people across the country because of the ACA, but particularly here in California, you cannot be discriminated against because you have a pre-existing health condition, right? That is part of state law. We also created Covered California. Now, that was actually done before I got to the legislature, but I helped author legislation to both increase subsidies to make insurance on Covered California more affordable, but also to stabilize the marketplace so that the actual premium increases, in addition to the subsidies, the premium increases themselves did not go up too high. In fact, for several years in a row, premium increases were under 1%, below inflation. Healthcare premiums on Covered California. And so that was, of course, due to the work of a lot of people, but I'm proud to have played a role in that. Before I got into the legislature, I actually started a not-for-profit to get children health care coverage because there were children who did not qualify for existing programs, and we had to provide health care coverage. 65,000 children in a 5-county area that I worked on. That not-for-profit no longer exists and doesn't have to exist. Why? Because we in the legislature are providing health care coverage to those children. And not only those children, we're going to be providing it to their parents and their grandparents, because by 2024, any low-income family, no matter their documentation status, could potentially qualify for health care coverage under Medi-Cal. So something I worked on before I got in the legislature, we've actually now made part of what is California. And then we think about the uninsured rate. It was stubbornly stuck at around 18%, decade after decade. Now, certainly the Affordable Care Act gave us the opportunity, but also additional policy. We built on the Affordable Care Act, and we slashed that uninsured rate by more than half. So certainly as a physician, that's a very proud accomplishment as well.
Absolutely. So you open doors and, if you will, put up a few important firewalls of protection that will outlast your time here in the legislature.
Yes. And one other thing I want to point out, too,
Yes.
especially since we're coming out, as we're struggling with this pandemic, is public health. Right before I came into the legislature, public health departments were slashing their budgets in counties. In fact, we had an outbreak of H1N1 influenza. And I remembered our public health officer in Sacramento County telling me that the people she was directing to try to control the H1N1 already had pink slips. And if the H1N1 outbreak happened just a few months later, she wouldn't have the staff to do that. And so we worked to say, look, we need to more sustainably support our public health infrastructure. And this year, we have the commitment from the governor for $300 million annually to support public health infrastructure in the state of California. So we're better prepared for the next pandemic, for outbreaks large and small, but also for things like chronic illness, sexually transmitted infections, dealing with other issues regarding toxic effects of dirty water or dirty air, which we are cleaning up, by the way. So I'm also proud about the work we've been able to do here in California, where we're leading the country in strengthening our public health infrastructure. We certainly still need more commitment from the federal government to do that sustainably as well, but we're not waiting for them. We're doing it here in California.
As you plan for the future, let's look back to the past, to some earlier times, because I don't know how many people know your own personal story or the details of the timeline arc between growing up as a son of immigrants on the East Coast and then seeking a career as a medical professional and then coming to California. You were born in Yonkers, New York, of all places, and raised in Pennsylvania, and you think Yonkers, but as a son of immigrants, I mean, Yonkers is a pretty diverse place right there by the Hudson River. Actually, a perfect place to land, if you will, right, in America.
Well, my parents came over to the United States to go to graduate school. So they immigrated from Taiwan. They were seeking greater opportunities here in the United States. This was, of course, post-World War II. I would make note that until essentially World War II, or actually a little after World War II, there was the Chinese Exclusion Act, which actually prevented people from China, and that kind of included Taiwan, from coming over to this country. But I think this country recognized that actually immigrants are a strength. And so my parents were able to come over for graduate studies, help contribute to this country. My father was a professor in New York, so that's why I was born in Yonkers, as you say. And then we actually moved to several different states around because of his work as actually an aeronautics engineer. And then, of course, went into medicine and continued to train in many institutions, but then came to California to be a faculty member at UC Davis for the opportunity to actually teach physicians about community health and about social determinants of health. And that's how I ended up in Sacramento.
And then was it the California Healthcare Foundation Fellowship that brought you here, or was it
Well,
something?
no. So actually what happened is that, so I like to say my journey went from the micro to the macro.
Yes,
so I went to college at Johns Hopkins, where I majored in biophysics.
Yes.
My interest was in discovering the next great cure, molecular biology, and so forth. But then as I went through my career, I went to medical school at the University of Pittsburgh and spent some time with the U.S. Public Health Service. By the way, in 1991, I was in Philadelphia for the measles outbreak that happened there and saw how important vaccinations was. But during that journey, I recognized how important it was to be sure that not only do we discover the next great cures, we need the scientists who do that, but also to be sure that people have access to them. We can discover amazing things about how to defeat disease, prevent disease, but if people can't get access to it, or we don't have policies to allow people to have access to it, then it's not helping people. And so in my career, I essentially shifted from saying, I'm going to discover the next great cure, to I need to be sure people get access to those great cures that my colleagues in medicine and in biomedical research and so forth are working on. And so in my career, as I went then to Boston to be at Mass General Hospital, then Boston Children's Hospital for fellowship, I really focused on how do we train doctors to interface with parents and communities to help build healthier communities, to address what we call the social determinants of health, because it's not just what care you get, it's the situation that you have in your home, in your
Exactly.
school, in your workplace. And then, of course, UC Davis said, we need somebody who's interested in doing that to teach our resident physicians at UC Davis. And that's how I ended up coming to Sacramento to be a faculty member at UC Davis to help run the residency training program and to train residents not only in pediatrics, but also in other primary care specialties and also other health professionals about social determinants of health, about partnering with community organizations to build healthier communities. So that's what I was doing before I ran for the legislature.
Well, speaking of that, as you looked across the fruited plain over to the state capitol, you have said recently that as a child of immigrants, you had never expected to run for or be elected to office. Yes. But it sounded like it was President Obama's election as the first African American to be president that opened your heart to the possibility.
Yeah, so my view is that as a child of immigrants, my parents' experiences, our family's experiences, was that I and my brothers, our family, people wouldn't vote for someone who looked or talked like us. You looked at who was actually making decisions as elected officials. We did not see people who looked like us. Now, I got much more involved through medical associations in terms of presenting to legislators, meeting with legislators, and being activated as an activated citizen. But I did not see myself in the role of an elected official because of our family's experience, frankly. And when I came to California, things looked a little different. More diverse community here in Sacramento, but still that was not in the cards. And then I saw that President Obama got elected. And even though he's an African American, he's not Asian American, something like, wow, the highest office of the land, the President of the United States, is no longer closed to someone who would look like me.
Right.
And that was certainly, I think, a profound statement. Certainly, the African American community, of course, is very proud of Barack Obama, but his election also meant a lot for many of us who are not African American. So his example and his leadership, and let me just also say something about his leadership in terms of the Affordable Care Act.
Yes.
If you look through history, many presidents have tried to do what we call health reform, right? Mm-hmm. And perhaps the most successful prior to Barack Obama was Lyndon Baines Johnson, who passed Medicare and Medicaid.
Right, and I know President Clinton tried.
Clinton tried, Nixon tried, Truman tried,
yeah.
I think Theodore Roosevelt tried. I
right.
mean, you go over and over and over again, right? And it was Barack Obama. And frankly, one could argue that the Affordable Care Act was a more profound change to the health care system than even Medicare and Medicaid. And he, by the skin of his teeth, got it done. And so that was a really remarkable achievement. I mean, a historic achievement. And then I had the opportunity to be able to build on that here in California.
As the first Asian American to represent this seat.
But also as, by the way, I think I'm the second physician to ever sit in the California Senate.
Wow, okay.
As well. I checked with Alex Vassar.
Well, that's yeah. good to know. And here, circa 2022,
yes.
the numbers are not, for women and communities
right.
of color, are not as robust as they could be, but the legislature is starting to look more and more like the people it represents.
It is. Although I would point out that women and people of color are still underrepresented. I chair the Asian American Pacific Islander Legislative Caucus. If you think about it, we have 40 state senators. Asians represent about, I think, 16% of our population. So if you do the math, there should be, I think, 6 Asian American state senators. Right now we have 2.
You and Senator Menn, yes,
exactly.
Yes. And when you leave, I don't know who might be coming in.
Actually, we're anticipating there will be another one elected in Senator Wachowski's seat because there's 2 Asian American women running against each other.
That's right.
But actually, when you look at all the other races, we'll still only be at 2 after I leave.
You had listed some of the accomplishments, jumpstarting the Affordable Care Act, securing it here in California, prioritizing children's health care, even your work on insulin. And now here we in California are going to be making our own insulin, which is a real game changer. So these are key accomplishments. Someone said that you never count your accomplishments, that you just do the work and look ahead to the results, even though I'm glad you listed a few of them with pride. Is that an accurate description?
Well, certainly we need to celebrate our victories, but there's always more work to do, and it is about the policy. So let me just give you an example this year. And I'm very grateful to Governor Newsom for his executive order on addressing equity and structural racism in state government.
Which he just announced this week as we speak. Yes.
Exactly. I would make note that I had a bill, SB 17, which actually I held and not moved to the governor's desk because of discussions we had with the governor's office. And I'm very grateful to him for then incorporating those elements of the bill, which since I'm leaving, we'll never have a bill with my name on it, signed by the governor saying that I authored a law on addressing this equity issue that we worked on for 2 years. But the policy is going to happen. Thanks to the governor and the partnership. And I appreciate he acknowledged in his policy statement the bill, which, of course, there's no bill to be signed now, but the policy is going to happen. And that's the most important part to me. So it's not always about like, oh, we got a bill signed or whatever else. It is really about changing policy. And I think this really is about thinking about, what can we continue to do to move our state forward, to make our state a more equitable place, a healthier place, a place that is going to improve lives. And it really is about working together and continuing to figure out how do we continue to move the ball forward. And that to me is the most important thing. And I'll tell you that, as a physician, I take care of children who have behavioral issues, right, and including things like ADHD. And I work with families, and we have treatments. We don't have a cure. There's nothing I can do to just say, okay, make the whole thing go away. And you have good days, you have bad days, right? And so we continue to work to try to be sure that we have many more good days than we have bad days. And sometimes despite our best efforts, bad days still happen. But it is about continuing to move forward. And that's the work that I've done clinically. And I sort of brought that over to the legislature as well, right? Okay, sometimes there are good days, well, bad days. But as long as I have more good days than bad days, and I keep growing the number of good days as a percentage, I feel like I made things better.
Well, you've offered me the perfect segue into the next question. You have pursued with dignity, but also risked your life in the process for the last several years, literally risked your life, in an effort to tighten children's vaccine laws and make our general vaccine law stronger, especially during the pandemic. And this has brought you into the crosshairs of this toxic anti-vaxxer movement, which, again, we don't have to go into the details because everybody knows the story, not to mention you. Confronting the unethical doctors in your profession who were enabling them, and also made you an active participant in the debate over the role that social media plays in that toxicity and harassment. So we've spoken to you several times on this podcast. You've done interviews everywhere about this. Everybody knows the details of those experiences and the details of the different vaccine-related bills that you've authored. But in the wake of all of this, you have been one of the few legislators in history, particularly here in California, who has had to face the pushback and the threats and the intimidation to this degree with really such a global notoriety, much of it really provocative and dehumanizing, I'll even say. I know you didn't come into the office with that scenario as part of your agenda, but looking back, how did you cope with that? How did your family cope with it? Would you do it again? Has the cost been worth it?
Of course I would do it again. I've devoted my career to children. I think protecting children's worth it. And unfortunately, there are those who want to threaten those of us who want to protect children. But we can't give in to that. What is the alternative? To let children get sick and die because we're afraid for our own lives? The real question is why should we have to be afraid for our own lives to do the right thing? That is the fundamental question. Like, I appreciate people praising me for my courage, but I guess the real question is, why do I have to be so courageous? Why do other people, and there are many other people, have to be so courageous in order to do the right thing? And again, have to recognize and very grateful to the support of my family, who unfortunately also gets caught up in this. I appreciate the strong support from my colleagues because they've also had to face this, whether they go to events and have people yell at them or their staff gets mail, and we had some district offices closed because they were fearful for the safety of the staff. Of course, my own staff has had to deal with that, getting hateful, not only letters, but also social media, etc. Why do we need to have so much hate? Why not talk about the facts, right? And when it comes to policy making, we should be making policy based on our best understanding of the science and the facts. And certainly we can have different approaches. So I appreciate in the legislature. We have people coming from all different parts of California, different backgrounds, and different perspectives on what we should do. And we should have vigorous debate, passionate debate. We don't need to have personal attacks and threats. How does that make us make better policy? So when people have to resort to personal threats, attacks, violence, they've already lost the debate. They're not interested in debate anymore. They're just interested in pushing their position, even though it's been shown to be wrong.
Going back a few generations,
Yes.
vaccines, it was accepted as a part of life, an expected, required part of life. Measles, mumps, rubella, polio. And now here we are in this century, and it's also politicized, and it's also toxic. That really comes down to the public discourse and the platform for that. And you have been involved in that. Have the social media companies, as you get ready to leave office here, shown that they're willing to be more accountable about the misinformation and the personal attacks that they provide the platform for?
Well, I certainly see there's more activity on the legislative front. So, for example, there was a bill I think recently signed by Governor Newsom to look at social media. There's federal legislation. We have other bills, of course, on his desk. Because social media has basically profited from amplifying extremism. And it's a challenge because too often the business model, which is about trying to attract attention so you can go to advertisers, is biased toward, if you want to try to be financially successful, toward pushing outrage and anger. And so that's the challenge for the social media companies, because as they're competing with each other, oftentimes the more outrage you allow, the more you can tell advertisers people are spending more time on my platforms. But unfortunately, this has been very dangerous and toxic to our democracy, to public health, and we really do need to come up with a sort of a societal way of addressing this. And in fact, even the social media companies, to their credit, have said, you know what, we need some regulation around this too. Now, one can argue sometimes they oppose some of the bills and other things, but I mean, we do need to create a level playing field, because we can't have a race to the bottom, right? So if a social media company tries to do the right thing, we can't have another social media company then saying, okay, well, we won't, and then take away your business. And I think also the advertising community needs to think about this as well and exert their influence to say, we don't want to be in a situation where our products and services are associated with extremism and toxicity. And so we do need to have this conversation about what kind of society do we want? Because social media technology is wonderful in terms of connecting people, but it can also bring people together for reasons that are harmful to our society, to our health.
Of course.
And we need to address that. We regulate cars. We require to have brakes and seat belts and airbags and certain frame designs, and those things make the cars more expensive. But we don't think it's acceptable to have cars where people are more likely to get killed or die in. And so when we talk about regulating social media, it's not about trying to ban them altogether. It's about being sure that they can operate safely in our society, that we're not destroying our society in the process.
The other element of this is the toxic attacks of racism against you as an Asian American, against Asian Americans in California, across the country. You've witnessed firsthand, and you have brought attention to, along with your colleague Senator Min, to the increasing rise in the harassment and attacks motivated by the racial bias toward the API community. As chair of the caucus, are you satisfied? Maybe that's not the right word. Are you at peace with, settled, or comfortable with the public awareness that has been raised about the bias and the attacks? And notwithstanding what the Newsom administration is trying to do to promote racial equality, do you think the message is getting across?
Well, one of the important things we've done in the legislature, and I need to thank Senator Medina, is that we're going to be requiring ethnic studies as part of high school graduation. And why is that so important is because when people don't know the full history of our country, it's harder for people to confront the challenges. And I want to be very clear about this, because there are some who say that teaching our true history means that we don't like or we hate our country, which can be nothing further than the truth. That is part of our history. Mm-hmm. And part of our history in the United States is to create a more perfect union. That is one of our aspirations. We want to create a more perfect union. Our Declaration of Independence sets ideals that we did not meet when we founded, we are not meeting now, but we aspire to. And it's so important to talk about how have we not succeeded and how have we succeeded and where do we still need to go. And so it's important for people to understand that history. And that includes, of course, AAPI history, because too many people don't know about the fact that Asian Americans were banned from being able to immigrate to this country just because of our race. That Japanese Americans were incarcerated not because they've committed any crime. So you read about habeas corpus and the rights that are enshrined in our Constitution, but yet were passed over when it came to a crisis and people were fearful. And it's an important lesson to learn because we don't want to repeat these mistakes. It's also important to understand how can we create a better society, a more perfect union. And so if we don't understand our full history, we won't be able to do that. We should not be afraid of looking at our past, and we should not be afraid of the future of what this country can become. But unfortunately, that fear is being played on by some people, including some people in elected office, and that is truly unfortunate. And unfortunately, it's not only, of course, that fear that's been amplified to drive hate and violence. And of course, with the COVID pandemic, it's disappointing that tropes that have been used in previous pandemics and in outbreaks and so forth have been directed again at the Asian American community. It's also been directed against Latinos as immigrants, right? And also the African American community as well. The Asian American community has been targeted with phrases like the China virus and Kung flu and other racist tropes. And of course, it's resulted in violence and murders. So it's so important that we push back on that, that people understand where these types of racist tropes come from so that they can reject them. Also, that we support people who've unfortunately had to be victims of hate and violence. And I'm very grateful to my colleagues in the legislature and to the governor for supporting a historic API equity budget to address these issues. Last year, with further funding this year, a sum that is greater than that by any other state. But yet at the same time, when you look at the size of the AAPI population, it is a small amount given how many AAPI Californians there are, but still a very important step. And we need to continue to build on that. We need to continue to look at how do we all work together. So this is not just about Asian Americans, because we know that also, while we've been a target of hate, other groups have been targets of hate as well. And we all need to come together as one in a more perfect union to say hate is unacceptable, violence is unacceptable. We need to work together to try to create that more perfect union so we can build a better California, a better United States of America.
This is profound, Dr. Pan. Thank you for sharing that. You mentioned COVID.
Yes.
There was an announcement this week, actually last night, as we speak, from the head of the World Health Organization, who said that the end of COVID-19 is in sight and that the world has never been in a better position to reach the long-awaited goal. And that the fact that COVID could potentially no longer be for all of us the specter that it has been the last 2.5 years, that's good news because it's claimed millions of lives. It's still claiming lives. It's recalibrated everything in our living lives. The world is not the same, and we are not the same people as we were 2.5 years ago. Do you agree with the World Health Organization? And where do you think we're going to be within a couple of years with this? Vaccines every year? What's your medical perspective?
Well, let's be clear. COVID-19 is not going anywhere. It's still with us. The question is that how do we interface with this virus that is amongst us and will continue to be amongst us? And will we still accept the fact that we have actually still hundreds of Americans dying every day of COVID? It's almost like an airplane crash every day. Right now, okay?
Yes.
That's still going on. I should also point out that in this country, because of politicization around vaccination, we have a higher death rate for our population than any other developed country. Now, since you mentioned the World Health Organization, we need to do a better job getting vaccines out to other countries as well. When we look at the excess mortality rate, so in other words, how many people expect to die based pre-COVID compared to how many are dying, it still shows there's a profound effect on COVID. And by the way, beyond death, okay, because everyone we're talking about how many people die, we still have long COVID, and we know that many countries are finding out that that's severely impacting their workforce. We talk about shortages of workers, disruptions in schools because of COVID infections, leading to not only death, but also disability, sometimes long-term disability as well. And that's something we're going to have to adjust to. And the degree that we have to adjust to it also depends on to what degree we allow this virus to continue to spread. So, as people suffer from long COVID and can't work, we are going to have to provide them with supports, disability payments, other types of things. We're going to have greater burdens on healthcare systems. Think about the fact that before COVID, every winter, hospitals would be full of patients with flu. All right? Now we're going to have flu and COVID. Okay, so that means we're going to probably have to build more hospital beds. And by the way, people who are in the hospital with COVID tend to stay in the hospital for a long time. They're not really short stays. They're kind of long stays. So that's going to be another expense we're going to have to figure out how to absorb. More hospital beds. We need more healthcare workers. By the way, we have a shortage. We've burnt them out. So we're going to need to figure that out too. And then, of course, for schools, if we have more children with long COVID, that's more special ed. COVID infections in pregnant women seem to lead to children potentially with developmental delays, more prematurity. Okay, that's more developmental disabilities. So we do have to think about this ongoing burden. Now, I would point out that we're not going to eradicate COVID anytime soon. No one's claiming that we just vaccinate everybody, we'd eradicate the disease. But we have to think about what we're willing to do to mitigate it, and if we don't do that, what the price of that will be. So I think in some senses, when the director of the World Health Organization says we see the end of COVID in sight, I think we stop seeing it as a crisis, but as a chronic condition. And then the question is, what are we willing to do to mitigate the impacts of that chronic condition on world health, on America's health, on California's health? What are we willing to do to mitigate that? And what price are we going to pay if we don't? And that's something we have to think policy-wise. And that's why when I, as chair of the Health Committee, I held a hearing on long COVID to start saying we need to start looking at that. That's why it's so important that we fund better public health infrastructure, because we had both COVID and then Mpox. Right?
Right. That's another one that's
And by the way,
now.
we had a measles outbreak in 2019, right before COVID. And so actually I'm very concerned about the undermining of trust in public health, because public health is how we most effectively control the spread of contagious diseases. And so we're going to need public health systems more than ever. And if we don't, we're going to pay the price in terms of our economy. We're going to pay a price in terms of our schooling. We're going to pay the price in terms of greater demands on our healthcare system and the costs that are associated with that as well, and many other impacts as well.
As you talk about this, it just reminds me there is so much unfinished business, still so much work to do, and I'm sure you have come to terms with that as you leave the legislature. But are you feeling like there's a lot of unfinished business for you? Do you say to yourself, gosh, if I only had one more term? How are you reconciling that as you leave, and leaving the message, leaving the work to be done for your colleagues, old and new, that come in?
One, we need great legislators, so please vote in the next election, okay? All right?
Right.
It's really important. Voting is really important. So please look at the candidates and vote for the ones who will work hard for people of California. Second of all, you don't have to be a legislator in order to try to influence better policy. So it is important to have good, because they get to vote, right? And certainly I've been honored and privileged to do that. But I was also, before I got in the legislature, I was, of course, talking to policymakers, legislators, people in administration, and I don't see that stopping. Yeah. So, I really appreciated the opportunity to serve in the legislature. But I'm actually kind of looking forward to going back, spending a little more time on the front lines now, because as a legislator, I wasn't, I couldn't do as much patient care. I continued to volunteer in a pediatric clinic, so I did see patients, but not as much as I wanted to. So maybe going back and, I guess, being an ordinary citizen, living by the rules that I helped shape, and then communicating that to my former colleagues, now friends, and saying, by the way, did you think about this? And we should do what about that? And of course, the new legislators who are going to get elected as well. So there's always a role to play. I sort of view this as simply shifting back again to what I was doing before. So I will miss being in the legislature. It was truly an honor to be in the legislature. I really appreciate the honor that my constituents gave me by electing me. But also, I'm looking forward to, in some ways, being a little freer to be my own person and then try to influence legislators instead of being one myself.
Well, and your wife, as you had said recently, she knew she was marrying a doctor. She didn't know she was marrying a lawmaker.
She can tell her relatives back home that she's now married to a doctor who's actually seeing patients again.
Well, and, you're not the only one leaving. Dr. Fauci, Anthony Fauci, and I don't know if you guys coordinated this, if he called you and said, Dr. Pan, are you leaving? Okay, then I'm going to. But here's another gentleman who is really in the macro level. You talk about somebody who could feel your pain, who has dealt with so much of this on a national and global scale, the threats and the criticism. But since the AIDS epidemic in the 80s, he has done so much to step up and pay attention to patients, streamline research. And it's really the fact that we had a COVID vaccine so quickly, thanks in great part to the work that he did a couple of decades ago. So maybe just as you leave here, what's your perspective on your national colleague at the Institutes of Health leaving too?
Well, Dr. Fauci is someone who has contributed tremendously to the health of America. And actually, it's a sign of the challenges that our country faces when Dr. Fauci is the target of so much ire. Certainly, there are things we can criticize about when HIV was spreading. There was a criticism as well of his approach. He's ably led the National Institute of Infectious Diseases and certainly is a giant in the field. I would also make note that legislation is a collective activity. We all need to work together. But it sort of goes back to what we talked a little bit about before. There shouldn't be so much bullying and hate and extremism when it comes to protecting our country, our state, our families from threats like infectious diseases. There's science. We learn more about diseases. COVID's a relatively new one. We're still learning about it. And we should think about how do we apply the knowledge that we have to our best ability, and things may change as things evolve. But let's try to work together and not go about politicizing, and then as a result of that, engage in threats, bullying, personal attacks. And so the fact that someone like Dr. Fauci, who's been an outstanding civil servant serving our country, has been the target of so much vitriol, I think speaks to some of the challenges this country is facing. Certainly, everyone should be subject potentially to criticism, and no one gets everything right. But to be subject to such personal vitriol, I think, is actually shameful that people think that that's fair game.
As a final question, and then I got to let you go. Sure. Putting your futurist hat on, in addition to your medical professional hat, are you optimistic for what's ahead medically in society, considering everything that you have endured just in the last couple of years, that our country, our world has endured? Are you feeling positive for the future?
I'm an optimist. I think that we can face our challenges if we're willing to work together and build a better future. And we've seen that over history. We're facing some pretty big challenges right now. But as I think Pogo said, we've met the enemy and it is us,
he is us.
Right? So, the climate crisis, it's about getting the political will to figure out how are we going to try to reduce our carbon emissions, right, and slow down this change. We have smart people working on different technologies and so forth, and then it's the will to be able to move that forward. We defeated smallpox, eradicated smallpox from the world because the world came together. Even as, think about all the different nations of the world and all the potential conflicts and so forth, and we were able to eradicate it. We've got to figure out how to be able to work together again. So unfortunately right now, polio, which we brought to the brink of eradication, is now back even in the United States potentially.
Yes,
right?
In New York, yes.
In New York, right? So one could say, well, is that a time for pessimism? We rolled back a fundamental right for Americans by overturning Roe versus Wade. So yes, some things have rolled back. At the same time, other things we've been rolling forward. So yes, these are challenging times. This is a time of crisis. We've gone through a pandemic. Over 1 million Americans have died of this pandemic. 1 million.
Yeah.
More than 1 million. More than all the wars that we've fought in our country since the founding of this republic. But I am optimistic that in the end, Americans will look at each other and say, we may have different ideas, but we're Americans. We can work together. And by the way, as Americans, we also are leaders in the world, and we will work with others in the world for a healthier, safer, more prosperous world, because it's not about who has what part of the pie. It's being sure that we create a pie that's big enough for everyone. And we can do that. And I'm an optimist that we can do that in the end.
I appreciate you being so profound and a perfect perspective to end on. Thank you for doing all these podcasts with me. Really, sincerely, all respect. You have improved lives, and I dare say even likely saved lives as you go through this process. I know we haven't heard the last of you. We will look you up if we have any medical questions, and hope our paths can cross again. So,
all right, thank you so very much, Ryan.
All right, thank you, Dr. Richard Pan from Sacramento. And that's a wrap for this edition of Then There's California. We are a production of the California State Senate Democratic Caucus, with technical assistance and production support from Martin Ashley, Bob Brulty, Brian Shadden, and Rainier Sabiniano, John Roman, McLeana Woods, Lisa Murphy, Blake Hooper, and the graphic artistry of Tim Davis. On behalf of Dr. Richard Pan, still representing, at least for now, California's 6th Senate District here in Sacramento, I'm Brian Green. Thanks for listening to Then There's California.